So now I'm going to just open the crestal portion very slightly with the 2-4 instrument. And the 2-4 instrument is a delta 2 tip, which means it's going to do most of the work at the crestal area. I'm gonna do a little bit. They're working phenomenal, Heinz. I mean, I'm not applying any apical pressure and the instrument is driving itself. Now I'm gonna back it out. I won't go to full depth. Let's just see how tight the implant is gonna be. And then we'll decide if we need to open a little more or not. And this here is a 3/7 by 13. I think we should still open a little bit more, maybe not. It's still a bit tight. Let's do a little more expansion. Okay, so re-engage. And right now I'm going to also start shooting towards the incisal edge. Fabulous instruments. Maybe I will go to full depth. Look how nicely, I'm not even holding it and I'm just rotating. So we are to full depth. So we are compressing the bone here and increasing the bone density essentially. Let's see now. This retractor is blinding me very badly, but it's okay. And there it goes. It engages beautifully. And now we're going to drive it to depth and then we'll graft around the socket. I'm going to countersink it a bit. Okay. We're doing fabulous. Excellent fixation. Perfect.